I've been seeing patients here in Hemet for roughly 12 years, and I began by treating low back pain, neck pain, symptoms along the spine. And over the last couple of years, we've been transitioning into wellness, honing in more on the subluxation, which I'll define in a minute here. As we treat the subluxation, which is a pinched nerve along the spine caused by a bone that's slightly out of place or a stiff joint, that frees up nerve energy and allows the rest of the body to work the way that it should. That is an excellent question. It seems like there's a dichotomy in the public. Some people are going toward wellness. Some people are working their best to work with natural medicines. Others are experiencing or going for what I'd call drive-through healthcare. If it can't be fixed with one pill one time, then it's not worth fixing. And so we're doing our best to educate people to make good lifestyle choices that will allow them to achieve optimal health or wellness. The chiropractic profession is not divided, but there are two ways that chiropractors, well, there are many ways that chiropractors can treat. We tend toward wellness or toward symptom abatement. If somebody comes in and their back hurts, we usually start them on a round of care to improve their back pain. But at my office, we try to take them from that toward wellness. We show them their history of subluxation patterns, whether it was poor posture or an increase in chemical, physical, or emotional stress. Do our best to find the causes of it and help the patient eliminate them and get back on the road to recovery, which goes beyond getting rid of the symptoms, but also treating the cause of the symptoms so that they're less likely to return and so that they can become healthier than they were before they began having the pain in the first place. I like to emphasize 5 different areas in people's lives that will make a tremendous difference. Diet, I'll just say them real quickly: diet, posture, exercise, rest, and stress management. Diet and weight are often very closely interlinked, and if people don't have a proper diet, if they're not taking in the right nutrients in the right amounts at the right times, then they are not going to become completely well. If they don't get proper rest, then they're not going to recover from the day's activities. Posture is important. Posture is a window into our spine, and the spine houses the part of the nervous system, the spinal cord and the spinal nerves. And that's a major source of interference in the nerve system between the brain and the rest of the body. And so if you don't have proper posture, you will have interference in the nerves, and that will diminish your health potential. We encourage them to do proper spinal exercises as well as a good overall aerobic exercise program and get them out there moving and having an active lifestyle. Stress. I'm not an expert in stress management, but I do try to find areas or pinpoint areas in my patients' lives where they can reduce some of their stress. Stress is one of those, that's like cholesterol. We need some to be strong, but if we have too much, it's going to diminish our health as well. I don't know if I could say any one organ or any one part of the body is the most important, because without the whole system working the way that it should, your body isn't going to be healthy. The brain, the nervous system, controls and coordinates every other system in the body. And if you don't have 100% nerve energy flowing between the brain and the rest of the body, the organs, the glands, the blood vessels, the muscles, and so forth, then they are not going to work the way that they should. And Dr. Windsor found he found approximately a 95% correlation where he found curves in the spine, and he followed those nerves where they went, and he found diseased organs in about 95% of the cases. So that is evidence, and the autopsies that have been performed since then have been excellent evidence to back up what chiropractors are saying about the importance of nerve system health. Find a good chiropractor. There are a lot of other healthcare practitioners that may be able to help you with your problem. I would say get a good chiropractor in your corner. We need a good medical doctor for emergencies and for other problems with your health. We need to have a good medical doctor on our side, and there are a lot of holistic healthcare practitioners that can help you. But I'd encourage everybody to see a chiropractor for optimal spinal health. Just like when you brush your teeth, you're going for good dental hygiene. When you get adjusted periodically and do other things to maintain spinal health, you will help your body to work the way that it should and allow a maximum amount of nerve energy to flow through your body so that the rest of the organs, blood vessels, glands can work at 100%.